Here we'll discuss the clinical anatomy of the hand with a focus on the bones and the muscles of the hand. The hands play an important role in facilitating the ability to perform general activities of daily living and fine motor skills. The key feature of humans and primates in general is that they have opposable thumbs, which allow for gripping and grasping of items so that these items can be manipulated. In this video, we will go through an overview of the basic surface and gross anatomy of the hand. One needs a basic understanding of the hand anatomy and function in order to interpret the clinical findings made when examining the hand. The hand is typically composed of 5 digits. The thumb is known as the first digit, whilst the small finger is known as the 5th digit. Some individuals may have extra digits, and this is known as polydactyly, and others may have fused digits, and this is known as syndactyly. Note that these are the phalanges, these are the metacarpal bones, and these are the carpal bones, or the wrist bones. Note that the 2nd, 3rd, 4th, and 5th digits have 3 phalanges, the proximal phalanx, the middle phalanx, and the distal phalanx, whilst the first digit has 2, the proximal and distal phalanx. The wrist is formed by 8 bones. Note that the first digit, or the thumb, is located radial side, and the 5th digit, or the pinky, is located ulnar side. These 8 carpal bones can be remembered using the following mnemonic. So long to pinky, here comes the thumb. So this is the scaphoid bone, this is the lunate bone, this is the triquetrum, this is the pisiform bone, this is the hamate, the capitate, the trapezoid, and the trapezium. The scaphoid is the most commonly fractured carpal bone. Looking at the hand surface anatomy, note that the metacarpal heads are located here, and this becomes more apparent why when we overlay the bones of the hand. As mentioned, the scaphoid bone is the most fractured wrist bone, and is located radial side here. Note the following triangle. It is bordered medially by the tendon for the extensor pollicis longus, laterally by the extensor pollicis brevis, and inferiorly by the radial styloid. This forms the anatomical snuff box. Patients with a scaphoid fracture will present with radial-sided wrist pain and tenderness over the anatomical snuff box. The hand is supplied by the radial and ulnar arteries. And this is the deep palmar arc, this is the superficial palmar arc, and this is where the radial pulse is palpated, and this is the ulnar artery. Note at the wrist, the flexor retinaculum is located on the palmar side, whilst the extensor retinaculum is located dorsally. Note at the phalanges, proximally is the MCPJ, or the metacarpal phalangeal joint, and the PIPJ, which is the proximal interphalangeal joint, and distally you have the DIPJ, which is your distal interphalangeal joint. The thumb is unique in that there's only an MCPJ and an IPJ, which is an interphalangeal joint, given that the thumb only has 2 phalanges. The hand has intrinsic and extrinsic muscles. Extrinsic muscles are those with muscle bellies located in the forearm with its insertions in the hand affecting the various hand movements, whilst intrinsic muscles are located within the hand itself. Now we're going to take a look at the intrinsic muscles of the hand and their various movements. Opponens pollicis opposes the thumb, the abductor pollicis brevis abducts the thumb, the flexor pollicis brevis flexes the thumb at the MCPJ and IPJ, the adductor pollicis adducts the thumb, the lumbricals flex the fingers at the MCPJ and extend them at the PIPJ, the opponens digiti minimi opposes the 5th digit, the flexor digiti minimi flexes the 5th digit, the abductor digiti minimi abducts the 5th digit, and the palmaris brevis pulls on the skin overlying the hypothenar eminence, which deepens the hollowing of the palm, which in turn improves the grip. Other intrinsic muscles not shown here include the interosseous muscles of the hand located between the metacarpals, which enable finger abduction and adduction. Now we're going to briefly look at the spaces of the hand. Taking a look at a cross-section of the hand, you'll observe the 1st and the 5th digit here. The lumbricals are shown here, and the adductor muscle of the thumb is here. Note the following deep spaces of the hand: the thenar space, the mid-palmar space, and the dorsal subaponeurotic space, and as well as the hypothenar space. Possible sites of infection may include the proximal forearm, which is known as the space of Peyronie infection, the ulnar bursa infection, thenar space infection, a mid-palmar space infection. There may also be involvement of the web spaces, which is known as a web space infection, and distally you may get a phelon infection or one surrounding the nail bed, which is known as a paronychia. And dorsally you may also have a dorsal subaponeurotic space infection.